Good morning, everybody. Thank you for tuning in for this next little bit, which is a question and answer session. And I'd like to thank you for attending the original webinar. I hope you had an evening of endodontic excitement, or at least enjoyment. So I've got quite a few questions to go through. I'm just going to go through them a little ad hoc-ish, but let's see how we get on. Okay, so I've been asked quite a few questions about discoloration of restored teeth. Well, yes, it still causes discoloration of teeth, but of course the question is, you don't want it in most of the canal or most, and you certainly don't want it in the clinical crown. It's only designed to be placed in the apical region of the tooth, and if you do it carefully, that won't be a problem. If you do place it inadvertently in the clinical crown, you need to remove it. Now, you can remove it using things like micro brushes, and maybe you can put some hydrogen peroxide on it to help clean it up. But if you're careful and you place it in the apical zone of the tooth, this should not be a problem. I've also asked, will this also happen with odontopaste? And I've got to say, I would assume so, but I'm not entirely correct because I don't know enough about odontopaste. There are, as we pointed out in the webinar, there are a few references to odontopaste around, but you can look this up yourself as easily as I can. But I can't really give you a definitive answer on that, unfortunately. I was asked also, how to use Ledermix paste and calcium hydroxide as medicaments. I assume this particular person was asking, and this is when we had the technical problems, how I use them. So I use them, I place the Ledermix apically, and I either use a Lentulo spiral carefully, and I went through how to choose a Lentulo spiral. Its size, the size must be smaller than the canal you're working in. So you've got to have a canal that's at least a 30 or a 35 to use them safely. And of course, make sure they're rotating forward, not backwards. Or you can use a paper point, or you can use a K-file, once again, smaller than the canal you're working in, obviously. And I use those to place the Ledermix apically, and then I fill the rest of the canal with calcium hydroxide. Now, I use, as I said, an injectable sort of calcium hydroxide because it's easy to use, and I can easily place them in the root canal. And then after I've done that, then I use my double seal technique. I was also asked, what do I think about non-aqueous calcium hydroxide? Look, they're fine. I just find one that's in a base of some sort and easy to handle is much easier for me to use. I was also asked, looking at other things here, let's just have a look at some of them. What brand, I was asked what brand of loops I was referring to. Well, there are lots of brands of loops on the market, and I think you can just approach any distributor and you should be able to find that information quite readily. I was also asked, is there any difference between sonic and ultrasonic activation of irrigants? Well, certainly there is. There's a significant difference between sonic and ultrasonic. And ultrasonic is a lot more effective than sonic because of the frequency of vibration. I was also asked, are there any contraindications to using Ledermix or odontopaste for the relief of pain? I have seen none. Both of these materials work well in this situation, but I have found in my own personal experience, and it's just my personal experience, that Ledermix has worked well. I've also quoted an article in there where it looked at the pain relief of both these medicaments, 2 articles actually, and you can see that they're both quite effective in this situation. Someone was asked, why do I use saline in my irrigation regime? Well, normally, no, I don't use saline in my irrigation routines at all. The only time I would use saline is when I have used a solvent and I wanted to help make sure I had removed all of the solvent. I do not see any point in using saline. There are other medicaments which are much more effective, and I don't see any point in using something that's only partially effective. Saline's good for dressing wounds, but I don't think it's particularly good for killing microorganisms and viri, etc., which you find in root canals, etc. So there are no contraindications for Ledermix use that I can see. Except for that one situation, we've seen one case report in the last 58 years with someone who had a problem with Ledermix. That's one out of the millions of times it's been used. What is my what is my view on single visit endodontics? I don't practice it except very occasionally where I had a vital pulp I wanted to remove and was being required for prosthodontic reasons. Other than that, I wouldn't advocate single visit endodontics because I think it's just too tiring on the patient and on the practitioner. So that is a problem why I would not use single visit endodontics, and also because we want particularly the calcium hydroxide to have some effect on reducing the bacterial load in the root canals. How long is it best to leave intracanal medications before obturation? I would think that at least a month is a good time period, but of course it depends on other things as well. It depends on the patient's symptoms, and it depends on the situation within the root canal. If you still have a root canal which is wet after you've removed the dressing material and you've dried it, then you don't fill a root canal then. And you want, of course, the tooth to be completely asymptomatic. Can we use biodentine to perform pulpotomies? Yes, we can. And how do we use it? Well, it wasn't really part of the lecture, but we use it in the same way that we would use any setting cement. So you just, over your pulp stumps, you pack down the biodentine using any device that you like to get it into place, and you have 1 or 2 millimeters of it, and then you restore the tooth in the way you wish to. Reference made to the Peter Parashos paper was showing no synergistic effect of using calcium hydroxide and Ledermix. Well, yes, that's true. He certainly did show that, but I don't want a synergistic effect. I just want the Ledermix to work for the 3 or 4 days and then the calcium hydroxide to take over the role or to continue its role in reducing bacteria and to fill the root canal with something. So it doesn't really worry me that they don't work better together. I just want them both to work. And also there's been some papers to show that the antibiotic and the triamcinolone don't work so well when they are together. But to me, for what I'm doing, this is not something that I stay awake worrying about. Does odontopaste need to be replaced at the 4-day mark in the same way that Ledermix does? Yes, I would suggest that it would, even though I have not seen any evidence to support this. I have not seen any diffusion studies on odontopaste, but I'm assuming that odontopaste being basically the same thing, except with some, as we know, the differences that I pointed out, would diffuse in the same way and would have the same effect. How do I rate odontopaste? I think it's an interesting material. It's a good material. I've had a not very much experience with it, but it filled the void when Ledermix wasn't there, and now we have 2 materials which we can use. Ledermix, of course, has a longer track record. Let's just move down here a little, if we can. This question asked about a 50-50 mix, the effect of this on antibiotics. No, is that effect on antibiotics, or does it mean the effect on bacteria? I'm not too sure, but the thing is that we know that the 50-50 mix will inactivate both ingredients in the fullness of time. So, but we're not really looking for the antibiotic use, in my opinion. We're looking for the corticosteroid effect. If you use Ledermix for a week and then change to calcium hydroxide, does this affect the prognosis of the tooth? Definitely not. No problems there at all. Best way to place the paste? Basically any safe way. As we mentioned, the lentulo with the both lentulos and K files or H files or whatever you want to use, reamers if you have some handy, they both should be smaller than the canal that you're working in. So I don't think there's a particular way to place a post that's better than another. You just want to make sure that it is apically placed so that it's effective. Some people would suggest that particularly once you've placed calcium hydroxide, you should take a radiograph to ensure that the calcium hydroxide is where you think it should be. And you want it to fill the root canal. So some people would suggest you take a radiograph to check its placement. Any toxic effect or byproducts by mixing different irrigations? Well, I'm not too sure what that is meant by that, but I don't mix my irrigations. I use one and then another. So I wouldn't be mixing them. There certainly is effects if you mix chlorhexidine with sodium hypochlorite because you get a brown sludge which is very difficult to remove. Someone's asked any clinical difference between odontopaste and Ledermix. Well, I think I've gone through that to some extent, but I don't really think there is. The corticosteroids and the antibiotics work in similar ways. So, what is the recommended sealer for using hot gutta perca techniques? Well, there is one that I've been using for a long period of time, which is available through another manufacturer, another distributor called Easy 2 Mix 2 Seal, which is a VDW product. Worthwhile having a look at. It's heat stable up to a much higher temperature than a lot of the other epoxy cements, which tend to break down under heat. Well, here's a wild question. What system do you use for obturation? Well, I just use a matched gutta perca point and my 2-seal cement and lateral condensation. And then after I've done that, then I would heat out to at least half to 2/3 the length of the root canal, and then I backfill if necessary. Question, I have heard against using 50-50 Ledermix and calcium hydroxide. Do I have any comments? Well, no, there's quite a bit of work to show that you can mix them. There's only one particular paper, the Parashos paper, who was actually the senior author, not the author of the article, where those research group showed that they become inactive more quickly. But if you do mix them a 50-50 mix, I have never found it an easy way to apply the mixed cement and paste into the root canal. So I don't do it that way because it was just too hard to use. Using Ledermix as its first and then an injectable calcium hydroxide, I just found as an easy way to do it. Complications of sodium hypochlorite through the apex, would it be better to use a low concentration? Well, yes, perhaps some people, that's why some people don't want to use the 4 and 6%, but if you're careful, you're not going to have a hypochlorite accident, and you're only basically going to have one if you have a perforation of some sort. I'd just like to say that there's another interesting webinar coming up through the Royal Australasian College of Dental Surgeons, putting in a plug for them on hypochlorite accidents, and that might be worthwhile having a look at, chasing that up. Can you use Ledermix for direct pulp capping? Yes, you can, but you have to expect that the Ledermix cement we're going to be using for a direct pulp capping perhaps is going to cause what we call calcific swirls, which was something that I was taught about in third year of dentistry in 1975, and that situation hasn't changed. It just keeps the pulp quiet for 2 or 3 years, but it makes the root canal therapy at a later date, if required, a bit more difficult. When do I use Ledermix cement? That's an interesting question. When do I use Ledermix cement? Well, I use it as a initial dressing, and I use it where I've got a patient who has some symptoms. That's when I use it. And would I use it in preference over odontopaste? Well, I do, not because this is a Ledermix seminar, but I do because it's the one I've got the most experience with. and I find it easy to use and reproducibly positive in my experiences. Should you leave the irrigant in the canal for 5 minutes just to sit there? No, you don't. You need to activate it in some way, even if it's only with a K file, smaller than the canal you're working in, of course, or paper points. And I would be exchanging it the whole time. So I'd be irrigating and suctioning it out for that time period. It is a little time consuming, but it's a worthwhile way to do it. And I think you're going to have a much greater clinical success with that. Is there a ratio for Ledermix to calcium hydroxide? Well, according to some of the articles I quoted, it's 50-50, but for me, it's sort of much more empirical than that. What's my opinion on the endoactivator? I think the ultrasonic activation systems now are much more effective than the endoactivator. The endoactivator was a useful device, and it still is a useful device if you can't access something else, but I think there are better ways to do it. How long do I leave in the medicament in the canal before I think they mean obturation. 1 month, how many weeks? I would be leaving it no more than a month myself. Comparing the True Anatomy file system to ProTape and X and Reciproc, which is best? I've only had limited experience with the True Anatomy system, but it looks a very good system. I've never been a user of ProTape and X, and I use Reciproc Blue, or I was using Reciproc Blue for nearly all my cases. So I'd have to say for me, and it's, as I said, you find a system that you use, which you can use, which is reliable and you like and produces good results, and you'll become familiar with it. And for me, that's the Reciproc Blue, and that's why I use it. Did you say not to mix the two pastes together, but rather place one on top of the other? Well, I did. That's what I did say. I don't mix them together because you get a glug, which makes it hard to use. So I inject one and then place the calcium hydroxide in later, as I said. What cement to use for normal and warm obturation? Well, I've gone through this a little previously, but I use the Easy to Mix 2 seal, which is a material that comes through VDW. So I use that in all my clinical cases. Before that, I was a Protocell person. I was probably the only person still using Protocell, but I like Protocell because it was, I found it a material that I could handle well. Of course, dental nurses don't like mixing Protocell because it is a bit hard to mix, but is that a reason not to use something? I'm not too sure. How to achieve a good seal after the initial dressing? I still use cotton pellets because I make them relatively small and I pack them into the orifice because I don't want things to go down the root canal, and I want someone else to know where the orifice is if I'm not around and they're opening the tooth up. And I've always been an advocate of a double seal approach, so I'm using Cavid, and it doesn't matter what sort of Cavid white, Cavid blue, Cavid pink, if they're still on the market, or Cavid grey. I use those, and then I place, after tamping it into place, I then place a GIC of some sort on the top. What is my opinion about agitation of irrigants by a well-fitted master cone or master point? Yes, I think that is a way to do it, but you don't get much agitation. You will get some apical penetration of the irrigant perhaps, but you won't get much agitation. If you want to agitate it, you've got to use some other system to do it. Do I normally irrigate the canal with saline or sodium hypochlorite before irrigation? Well, I never use saline, and I would have just been, before I've obturated, if it's a second appointment, I would have had a lot of irrigant in there anyhow. So I don't place it particularly because I'm going to obturate it. It's there because I've been using it. Do you recommend using chlorhexidine as an irrigant? The only situation where I'd use chlorhexidine is in a retreatment case, And then I'm very careful. I would then need to wash the canal out with some saline in that situation only before I use sodium hypochlorite. And I'd also want to wash it out, activate it with the saline in there, and then dry it carefully before placing the sodium hypochlorite. What loops am I using? Well, I'm not using any loops because I use a microscope. But as I said, if for endodontics, you need to have good magnification, and you also need to have very good illumination. I was asked here if I was applying Ledermix initially and it's only effective for 4 days, how long after I get the patient back to place the calcium hydroxide? Well, I don't get the patient back because what I've done is I put the Ledermix in. I know it's going to be ineffective after 4 days, and I've also placed the calcium hydroxide at the same time, at that same appointment. So I don't get the patient back just to place calcium hydroxide. I'll bring the patient back in 1 to 2 weeks to see how the patient is getting on, and perhaps re-prepping a little, just finalising my apical preparation, and then I'd be placing calcium hydroxide. What do you do when the pulp is calcified? Being an endodontist, that's not a situation I have a problem with really. I just use other techniques to work in a calcified canal. If you're interested, the Australian Society of Endodontology New South Wales branch is having a meeting early next week, I think, which is going to be video cast where you could have a look at that. And we have a presenter from overseas who's going to be working on calcified canals. So that particular practitioner, if you'd like to look that up, he will find that might be of useful. The ASC New South Wales branch having their meeting with that. What is the best medicament to use when the canal is infected and pus? Infected with pus, I guess, or infected and pussy. Well, in these situations, it takes a lot long to prepare the root canal. You have to try and ensure that you've got as much of the pus out as possible. Use lots of irrigation. Put a small K-file through the end of the tooth to ensure that you've allowing the pus to escape. Perhaps milk the soft tissues to also help get the pus out of the tooth. In these situations, after I've let the tooth drain for maybe half an hour or longer in some occasions, I would be placing Ledermix apically, and I'd still place calcium hydroxide. I'd put a double seal, and I'd ensure my temporary is out of, the tooth is out of occlusion. Is there any difference between Ledermix and then odontopaste regarding discoloration of teeth? Probably not. I haven't seen any research on that, but I assume that they work in a similar sort of way. What irrigant do I use if there's a perforation? If I have a perforation, in this situation, I'd be using saline. I know I said that I hardly ever use saline, but this is a situation where I would use saline. But I'd also be making sure that I'm ensuring my irrigant does not get into the soft tissues if I can help it at all. Can I please explain my protocol for irrigation sequence at various stages? Well, as I said, my primary irrigant is sodium hypochlorite, of which I use lots of. I use EDTA. Occasionally in the situation, in the root canal prep, if I'm wanting to open up the dentine or tubules, etc., then I'd be activating, and then I'd be using sodium hypochlorite again, and then I'd maybe have another rinse with EDTA, but I'd always finalise things with sodium hypochlorite. And I'll be using a lot more sodium hypochlorite than I would with EDTA, which is why we recommend the 10 ml syringes and the 5 ml syringes. 10 ml for hypochlorite and 5 ml for the EDTA. How do I manage hypochlorite accidents? Well, I've gone through that briefly, but also there's that college webinar coming up on that, worthwhile having a look at. As I said, all the endo textbooks have chapters on it. But how do I manage them? Basically, it's a matter of trying to dilute the sodium hypochlorite that's gone into the soft tissues, using saline. Then you've got the problems of dealing with the patient, they're dealing with their significant amounts of pain. Maybe you need to use some corticosteroids as well, as in ones that the patient would take. Then you need to also have them on painkillers, and maybe the sequence of paracetamol and Nurofen alternating for a couple of days is good. You also have to make sure that you've rung the patient. I'd be ringing the patient initially once they've got home, and then the next day, and then the day after that, and then you want to be available to see them, and you've got to make sure that you allow your medical insurance people to know, because it could become quite difficult for you. Is the antibiotic in Ledermix contraindicated in pregnancy? No, I've never seen that, so I wouldn't be suggesting it would be. Someone has asked, as my experience, did I find odonto paste as efficient as Ledermix and calcium hydroxide? I myself did not find odonto paste to be quite as effective, but maybe that was because I didn't think it was going to work as well anyhow. But the evidence out there does suggest that odonto paste is at least as effective as Ledermix. Is there a place for ozone and endodontics? This is something that got a person in Melbourne into a lot of trouble 3 or 4 years ago, which we won't go into. But no, I don't think there's a place for ozone and endodontics. How long do I leave the calcium hydroxide Ledermix combo in the tooth before a final fill? It depends on the patient, it depends on the symptoms, but I'm suggesting probably about a month. Do we have studies comparing Ledermix to odonto paste? No, not really. Sorry, there aren't any out there. When do you use my VDW Eddy? When I'm irrigating my root canals. So that's what I was talking about. That's how I activate the solution. Look, if you don't have access to an Eddy system, you can use the Dentsply Sirona device, or if you have a K file or any sort of file that's much smaller than the canal, you can activate it using your ultrasonics. But just be very careful that it doesn't touch the walls of the root canal, otherwise you will gouge them. This is an interesting question. What's my take on Ledermix cement? Is there a place for it? Yes. Well, I think there's a big place for Ledermix cement, particularly in patients who have discomfort. If I have a large periapical infection, how often do I schedule my patient's appointment? Well, I would suggest there that you be looking every month if the patient is asymptomatic, or sooner if they're symptomatic. Do you want to wait till you can see evidence of the periapical infection improving? A difficult question to answer. I generally would say that I haven't. I more go on the patient's symptoms and ensuring that the tooth is well sealed between visits. And I certainly do wait for the symptoms to subside before obturating or root filling any root canal. I want the patient to be out of pain. I want the root canal to be dry before I place my root filling. Can I comment on the rotary file system, the FKG XP EndoShaper? Yes, it's a very interesting system and I have used it, and I would think that it is a good system. Probably are some other systems now which are a little better, but it all depends on personal use. If you like it and you're getting good results and you can fit your GP points well to the canal as you're prepared, well then I would suggest that you stick with whatever system you're getting good results with, really. What's the best way to extend the use of cavet in storage? It does go hard in the drawer, I've got to say, and I'm not too sure what's the best way to extend it. Perhaps use it more rapidly or use smaller jars. But we found that we moved from the jars to the little tubes and it worked, but we got longer life out of it that way. I've gone through what is my cement of choice. Do I feel that an early definitive restoration is better placed than waiting for 6 months or more? Yes, I would suggest that it's better to get the tooth root filled, once after root filling, to get the tooth restored definitively as soon as possible, assuming the patient is symptomless. So I think really you've got to get that final restoration on as quickly as you can. It doesn't necessarily have to be a crown, but perhaps a large all-encompassing restoration, and perhaps a ortho band around it to hold it all together is the way to go while you're waiting for the patient to be able to afford a crown. Someone here suggested my grandson is very clever. Yes, well, I would agree that he is, but I don't think we need to go into that really. I think I've gone through most of the questions now. A PDF has been sent out to everybody, I believe. If there's any questions on it, I'm more than happy for people to get in contact with me. My email address is there. You can contact me on that if you would like. I'm more than happy to answer any questions from people. I hope you found it a enjoyable and a useful time that you spent revising, which is basically all it was. It was just a revision of the basic steps to achieve predictable endodontic treatment and results, and just refreshing our memories of what medicaments we should use and why Ledermix is so useful. Thank you very much.